She won most talkative in high school, and she has been running her mouth ever since. Welcome to the Lisa Fischer Said Podcast with your host, Lisa Fischer.
All right, we get to talk about health again, and this time from somebody who is in the hot seat. Dr. Katie, which is the best name, Deming, you're really getting in the weeds because you're starting to stand up to people to say, and you're saying things like, I don't know if I believe that anymore. Kind of tell me your story because you're a radiological oncologist. Is that accurate?
I'm a radiation oncologist.
A radiation oncologist. Okay. So tell me what's happened and what you're saying now.
Sure. Well, so I traditionally trained Western medical doctor. I trained at Duke University in North Carolina, and then I've practiced as a radiation oncologist for 20 years, also served as a healthcare leader, running end-to-end cancer care for one of the largest healthcare organizations in the U.S. And in 2019, I started getting these, I would just describe them as messages, but basically I was like, I think I'm not supposed to be doing this. But it didn't make sense because I trained until I was 32 to become a radiation oncologist. And what else would I do if I wasn't supposed to do this? But I was getting these messages. I was ignoring them. I heard a parable, and this was shortly before I started getting the messages, and the parable really caught my attention. And the parable is the parable of the river. And it goes something like this, that once upon a time, there was a village perched along the side of a river. And one day the villagers noticed a person who was drowning in the river. And so they sent someone out to save that person, brought them onto dry land. And the next day there were 2 people drowning in the river. So the villagers sent 2 people out to rescue those people and get them onto dry land. And then the next day there were 4, and then 8 and 16 and so on and so on. It was doubling every day. And so the villagers organized themselves and created this elaborate rescue system to rescue all these people who were doubling every day, drowning in the river. And the village elders praised the villagers for their amazing work. And I heard this in 2019 at a meditation retreat with one of my colleagues who was a GYN oncologist. And I turned to her and I said, this is us. Like, we are glorified rescue workers on the river. This is Western medicine, Western oncology. And what the heck is happening? Why are we seeing younger and younger people in our offices every day? Why are we getting sicker? Why, if we're doing such a good job, why are so many more people getting cancer? And also, by the way, when we get them onto dry land, I have no idea what actually caused this. Like, most of the time we say to people, I don't know. It's just bad luck. The risk of a genetic abnormality being related to cancer, having it being hereditary, is less than 10%. So 90% of the time we were saying, I don't know. And so that had started my wheels turning in 2018. And then in 2019, I was getting this message, you're not supposed to be doing this. But in 2020, I had an experience similar to a near-death experience. It's called a shared death experience. And it happens actually commonly to family members who are at the, site when someone transitions, but it can also happen to healthcare providers. And that happened to me where basically I experienced something similar to a near-death experience of that love and the light and the things that people describe in a near-death experience I experienced when a patient was dying. And that blew the lid off things for me because I knew after that event that those messages that I was getting were not like some accident or whatever, and that I actually needed to leave, that there was something wrong, that Western medicine had its place. Definitely, I believe that there's a role for some of these therapies, but I knew that it wasn't solving the problem. And because I had spent so much time around people who were dying, I'd cared for over 5,000 patients in my career. And about 40% of my practice was palliative, meaning that those people eventually may die of their cancer. I've spent a lot of time around people who are facing the end of their life. And the one thing that they say, the top regret, is I wish that I had been true to myself. I wish I had the courage to live my truth, to speak my truth, to be who I was authentically. And so I knew after this event that if I did not do what I knew I needed to do, which was leave, that I would regret it at the end of my life. And I've seen too many people regret, not living the life that they were here to live. And so even though it blew up my life completely, my husband wasn't supportive. And that was part of the reason why it took me so long, is because he thought something was wrong with me. When I was telling him in 2019, I'm like, I think I need to leave. And he said, you make a lot of money, you do meaningful work, you care for people with cancer, you're great at it, your colleagues love you, your patients love you. Maybe something's wrong with you if you're not happy. And so I internalized that and was thinking maybe something was wrong for me. And it was this event in 2020 that made me realize, oh, no, nothing's wrong with me. There's something wrong with the system and I need to leave. And there's one other piece to that, is that right before that event had happened, just like the week or two before, I had been nominated 6 months earlier for the highest position within the healthcare organization that I worked for, which is one of the largest healthcare organizations in the US. I had been nominated to become the medical director of all of cancer care. And I had been interviewing for that position for 4 months. It was a really elaborate, nationwide search. And there were 6 oncologists who had been nominated for that position. And I had gone through the whole process. And then at the very end, it came down to me and another woman. And I didn't get the position. They gave it to the other woman. And they told me, they said, your ideas, you kind of blew us out of the water. We didn't expect someone to come in with the ideas that you had, but the organization's not ready for this. And I knew when I didn't get it that I was meant to build something, but it wasn't in the system. And then that event happened. And then I was like, okay, I'm listening. I'm like, universe, God, whatever. I'm listening. And the hard part was, though, that I didn't know what the answer was, right? Because I knew then that I wasn't going to go get additional training, because now I was starting to worry that maybe the system, there was something wrong with the way I'd been trained. So anyway, that's the start of it. That's how I ended up leaving Western medicine and kind of branching out to explore holistic healing and natural healing for cancer.
So the exit ramp for somebody who's traditionally trained Western medicine is what? Going out on her own and looking like the village witch? I mean,
yeah,
your peers probably don't answer your calls when you want to play golf now.
Yeah.
And
my husband left me. So, my husband left me. Is that
right?
Mm-hmm. Yep. Yeah.
Wow. Okay. Drop the mic. That is you live by your convictions. Was he in the medical field, your husband?
No. So I was a primary breadwinner, and he just, the truth is that I have a lot of compassion, because he was scared, and he was like, well, what are you going to do? And he just thought I was losing my mind, that I was just going to, because
how conflicted you were. I can't even imagine. To have the very person you're married to, see, that would have pushed me back, I guess. I have a supportive husband with my crazy, wacky, let's get out there ideas. But if I had a roadblock, I really admire you.
Thank you.
Because I would have gone, all right, I just have 20 more years of this. Okay, fine.
Well, what I said to him was, I said, I would do anything for you, but I won't abandon myself, because I know at the end of this life that we leave here alone. We leave without anyone else. I'm going to have to answer to myself, and I'm not going to be able to say, oh, my husband wanted me to stay in that job. So for me, it was a spiritual decision.
For sure. It is very, that is really, really deep. So what was the first thing you did? Do you hang out a shingle saying?
No. So
what do you do?
Yeah. So what I started doing was, I needed time off. And that was actually part of the reason why I ended up getting a divorce, because my husband was like, well, if you had, if you knew what you're going to do, or we had a plan, but I basically said, I need to leave and I need to take some time, because I didn't know what the answers were. And I was so nervous about all the institutions and where I could go do additional training that I just didn't want to do that. I wanted to explore on my own to really see if I could find, more of the truth, right? And I don't think there's a truth with a capital T, but I was looking for something that aligned and felt true to me. And so I started
better.
Yes.
You realized you were at a dead end, because we see recurrence in patients, and people whatever it is, it's not working, people.
Yeah. Well, I mean, just look at 100 years ago, 1 in 33 people would get cancer in their lifetime.
And now it's
today in 2025, it's 1 in 2. 1 in 2
so there
people.
are 2 of us.
Yes. Yeah.
Okay. That is shocking.
Yeah. So what I started doing was, I took time off. I ended up taking like a little over a year off. It was more than I expected. I thought I would take less time, but as I realized I needed to do my own healing and processing of, what I had just left, and also really learning, what it was that I wasn't taught in Western medicine. And what I started studying was what makes us well, because everything in medicine that we're taught in allopathic medical school is what makes you sick. So pathophysiology, like thinking of the body as a machine. And when something goes wrong, how do you give a pill or give radiation or chemotherapy or surgery to fix that problem?
But it doesn't fix it.
It doesn't. Yeah. It fixes it superficially, but it doesn't actually fix the underlying problem. So what I looked at was what makes us well. And that really came down to, it's bringing wholeness. Like, what is healing? Healing is bringing wholeness back to the human. And in this case, since I'm a human doctor, not a veterinarian, so I was looking at, okay, what brings wholeness? And then I realized it's spiritual, it's emotional, it's mental, it's physical. And as I started digging into some of these areas, I was shocked to learn that there are big studies correlating emotional trauma with illness, like the ACE study, which is the Adverse Childhood Event Study. And that basically looks at children. It's a huge study, thousands of children that were followed from childhood all the way into adulthood. And they counted the number of ACEs that these children had. And ACEs are adverse childhood events, which are basically a trauma. So it could be abuse, physical abuse, could be sexual abuse, could be neglect, could be an incarcerated parent, someone with a drug addiction, divorce. There's a lot of things. But what they found was, the higher the ACE score, so the higher the number of these traumas, the higher the incidence of cancer, which I had never heard about, higher incidence of obesity, higher incidence of diabetes, cardiovascular disease, COPD, emphysema. And I was like, how come I never heard about that? And then if you look at studies of people who experience like a collective trauma, like Holocaust survivors, they have a very high risk of cancer. And then looking at the studies of like people who healed themselves. So the radical remission work, which comes from Kelly Turner, who's a PhD, and she studied people who healed themselves from cancer without conventional therapy, or some conventional therapy that wouldn't be expected to cure them. And there were 10 factors that she found. This is not causation, right? They're just correlated. So she found 10 common things that people do. And 2 of them had to do with emotions. So releasing past trauma and then cultivating positive emotions. And so that piece really stood out to me. Like, I knew that there was something about diet. I knew that you needed to do, supplements. I knew all of that, but I had no idea the impact of emotions on physical illness and healing in the body. So basically, I spent time studying all of this. And then ultimately in the fall of 2022, fall of 2023. Yeah, because I left Western medicine in July of 2022. In the fall of 2023, I launched a practice. And what's interesting is my practice has really evolved. I started out thinking that I was going to help people getting conventional therapy for cancer, so chemotherapy, radiation, surgery.
Oh, you did?
Yeah, I thought that I was going to be helping them, but getting at the root cause. So I felt like there was a place for the therapies, but then I would be helping them with the emotional stuff, with the, environmental stuff, detoxing, nourishing, all of that. But what's interesting is, as I have started practicing, and now that I've been in practice for, it's only been actually like a year and a half now, is that I realized that the people who didn't do that stuff did the best. So now my practice I still help people who do conventional therapy, but they want to do, kind of a blend of integrative and conventional. But more and more of my practice is moving into this space of natural healing. And that to me was surprising, which is beautiful. What I kind of love about my journey is that I had no expectations. I just knew something was wrong. And then I was helping with what I knew. But now I've been, kind of led out into this space where I realized that, you can heal cancer without any of that stuff. And that surprised me.
Well, you're seeing too that each person is a study of one.
Yeah.
One person's case isn't like somebody else's, and his or her approach and a score. I mean, there's so many things rather than conventional medicine says, oh, you have estrogen positive in situ, whatever all these words are. You do this. This is the formula. There's not a formula. What's your ACE score? Do you have one? You have a high ACE
mine
score?
would be very high. I have a lot of history of trauma in my childhood, but so I'm
Me
like,
too.
I don't know what the score is, but it would be high.
I thought I was an 8, and then I redid it. I'm really a 7 because it has to happen before age 18. I had a brother go to prison, but I was after age 18. So it is truly in childhood. But yeah, mine's up there.
Yeah.
But that's why I probably have such an interest in health. I'm just reading the book, The Deepest Well. Have you read that?
Oh, I haven't.
She is a San Francisco MD pediatrician. It's similar to The Body Keeps a Score and Gabor Mate's The Myth of Normal. Her whole study. I'm just looking at now my Audible. I'm on chapter 3 and children in poverty in San Francisco.
Who's the author? Is it Naomi? Is it?
No, Nadine Burke-Harris.
Yeah, that's her. Okay, so she has an amazing TED Talk about the ACE study and then the work that she does in San Francisco. She does amazing work. I haven't read her book, though.
May have tears in my eyes even trying to talk about it with you because it's so compelling what she talks about, what she's observed. So your childhood, not that we would need to hang on to every bruise, and we can't, every hurt, but it makes a lot of sense. Just saying, it's a very valuable book, and I need to put that in the show notes just because if anyone has a high ACE score, just to hear about it. Okay.
Well, and what I love about what she's doing is she's trying to get ahead of it, right? So she's trying to help these children. The work that she does in San Francisco is help the children who have high ACE scores so that they don't end up being that statistic. That's right. I love this. I love the idea of getting ahead of it. Like, let's not wait until people have cancer. That's what I do, right? So I'm helping the people who already developed cancer and then dealing with the emotional trauma, but she's working to get ahead of that. So maybe we can mitigate that for those children, which is beautiful.
Well, let's talk about children and cancer. So, I know that for me, I've made the statement, if I were ever to get diagnosed with cancer, I would not treat it with chemotherapy and radiation because there are just so many other modalities and I'm an intermittent faster and on, right? But for a child, I heard one of my guests said it's against the law not to give your child chemotherapy and radiation, that child services could come and take your child. You're exhaling. So is there truth in that statement? Mm-hmm.
I was trained in pediatric radiation oncology, but I haven't practiced it in 20 years. But that is true that it's considered, as an adult, you can choose. They say it's against medical advice, right? Which is terrible because it's, like you said, everyone is an individual. And I really believe that, our sovereignty in choosing how we, treat our bodies is so important. But for children, the medical professionals can actually override the parents, and it's tragic. Yeah, no. And actually I see that. So I don't see children, but I have actually parents or uncles, aunts who've reached out to me to say, the doctors are threatening to take away the children. Can you help us with an, holistic plan and to deal with all of this? And I just don't, I don't have enough knowledge about with the children. So I haven't taken on those cases, but I know that's happening right now because I get emails about it.
And there are laws involved that could compromise your future. It's a very difficult situation. Cancer is a difficult situation. And that's the one thing I want to make clear in this. Anyone listening, neither of us is here to condemn you on a decision you've made, if it's not what we're talking about. I just want to tell people that there are options. And as a health coach, obviously I don't give medical advice. Anytime my clients come to me and say, thus and so, I just say, have you been informed? It was the same thing I said during COVID when they would say, what do you think about the COVID shot? I'd go, well, it's your body, your choice, but I just want to make sure you're informed. If they look through all the same thing with a GLP-1 agonist, say, have you looked at the black box warning? And if you want to take the risks, it's your body, you do it. So that's how I feel about all of this. And not that anybody cares, but I'm just saying, I have no judgment, and I know you don't either. It's just, once your eyes are opened, it's hard to unsee what you've seen. So in the fact that you can't unsee what you've seen, what are you doing now let's talk about the ones that are not following a traditional Western plan of radiation and chemotherapy and immunotherapy. Yeah. What are some options people have?
Yeah. Well, like, I didn't expect this, and I wasn't looking for it, but my mentor, he heals in the ancient ways and teaches how to heal in the ancient ways, had said to me, this was in the fall of 2023, shortly after I launched my practice, that you could heal cancer with a 30-day water fast.
Oh, for sure.
And I was like, what? Like, people can go that long without food? And I know that Jesus went into the desert, and, Buddha sat under the tree and for 40 days and meditated. And I know that from a spiritual perspective, but I had never heard that. And there are fasting centers that do that. But
yes.
So I had one client who was like, well, I'll try. And we ended up only fasting her for 17 days because she had a trip planned. And so we just went that far. But she had breast cancer that had spread to her brain. She had a HER2 positive breast cancer, which is considered, I don't like these words that they use, like an aggressive type of breast cancer. But so she had a metastasis to her brain, and she had radiosurgery, which is a type of very focused radiation into the brain. And then she met me. And so we ended up doing a lot of other things. So changed her diet, supplements, emotional work, but then she did a 17-day water fast. And when she went back for her MRI after, 3 months later, she went back to the neurosurgeon, and the neurosurgeon was like, it's gone. And she said, well, isn't that what's supposed to happen? He said, no, because with radiosurgery, what happens is actually 3 months after the radiosurgery, the tumor usually is bigger because of swelling, but it's a little bit less contrast enhancing. And then at 6 months, you'll start to see it starting to shrink. But even like 7 years out, you'll still see like a nubbin of something. And oftentimes there's a lot of damage around the tumor in the normal brain tissue from the radiation. It's called radiation necrosis, which just means dead tissue from radiation. And so he said, no, this is not at all what I expected. And so I said, can you send me the images? And I can send you actually a copy. I don't know if I should do a little Instagram post, and maybe we can link that to you for you. But she had her MRI when I got it. It was completely clean, like as if there had never been a tumor there. So not only was the tumor gone, but she didn't have any of the radiation damage. And so my mind was blown. I was like, what? How? And you have to understand that I come from the Western paradigm. And so this is all new for me. I had no idea
you could never been introduced, even though Otto Warburg and the metabolic method.
I knew from a metabolic perspective, and I was, talking about treating cancer from a metabolic perspective.
But would you roll your eyes when you said it, or did you believe it? You believe it?
I believe it. But a ketogenic diet doesn't make cancer go away. It basically puts it into a holding pattern because you are, you're eliminating the glucose, right?
Yeah, right. Mm-hmm.
But to have it disappear, that's not seen on a ketogenic diet. So I just was so surprised by this. So then my next client who did a water fast, she did, I think it was 14 days. And same thing, it was limited by how much time she could take off work. She was an attorney, and she actually had stage 4 breast cancer, but she had a recurrence of the breast cancer in her breast. And the surgeon was recommending a mastectomy. And I was like, well, from their perspective, you're incurable. Why do they want to take off your breast? I said, well, they give us a couple months to see if we can get it to shrink or, get some change. And so we did the same thing, emotional work, diet, supplements, and then we did this water fast. And when she went back in, had her mammogram to prep for her mastectomy, it was gone.
So no need for a mammogram.
No need for mastectomy. Yeah, so she didn't end up having to have the mastectomy.
Yeah. Oh my gosh.
So that's what started it. But then what happened was I didn't want to do the fasting because it was something that it was new for me. I wasn't trained in it. So I started sending people there's some fasting centers.
Like Dr. Alan Goldhammer's?
Yeah, in True North in Northern California. Yeah. Mm-hmm. But the problem was that they're pushing a plant-based diet on them, which is absolutely, from a cancer perspective and a metabolic perspective, thinking of cancer as a metabolic perspective, they refeed them with fruit juices.
That's
and
what I was just afraid
like,
of. Mm-hmm.
This is not, and also like all of the stuff that I'd been working with them on diet, they would be there and being told, oh, animal fats are bad and all this stuff that I knew.
Why did they say that? That baffles me.
It's just their, it's their center. It's their thing. Like their thing has been a plant-based diet.
For that.
What's that?
Was there science that backed up those claims?
I mean, Goldhammer's been running that facility for a very long time.
40 years or
so. So
I've interviewed him, yeah.
Yeah, so, and he believes that a plant-based diet, no oils, is like the best diet. And just my experience when I started sending people there was like, oh gosh, this is not okay for my people. Because number one, it was confusing them from a dietary perspective. And then two, you're basically feeding the cancer right out of the fast and the microbiome. Basically, you just reset their microbiome and now you're giving them a ton of fruit.
Because, the legumes, the glucose and fructose, I guess, at that point feeds the glucose, which the metabolic method approach attacks glutamine and glucose, right?
Yeah. So fructose acts like glucose in the body, right? So the cancer cells use fructose just like they use glucose. And then with the microbiome, you've just reset it. And by introducing all of those, all that fructose, you're basically feeding the bad bacteria to bring that back online. So ultimately, I decided, I was like, okay, I have to do this. So I just started in the beginning of February doing group remote fasting and fast people anywhere from I have someone who's doing 7 days next week, but usually 14 days to 30 days. And
do you feel like they need to have medical supervision since you're remote? Do you still want them to have lab work done?
Yeah, so we do lab work. So they do lab work once a week, and they do their vitals every day, and they're monitored that way. And the results have been incredible. Now, clinically, it's soon to see what the results are, right? Because not everyone, it takes 6 weeks after they finish the fast and refeeding to get scans or, lab tests to see how they've responded. But ones who, we had a gentleman with head and neck cancer where he had a lymph node in his neck and a mass in his tongue, and his speech became clearer while he was fasting, suggesting that the tumor in the tongue was reducing. And then the node in his neck went away. And then just emotional clarity, they get so clear because they're detoxing their body so fast. Basically, you're getting them into ketosis, which is great because you're cutting off the fuel supply for the cancer. Then you're detoxing their body because they're dumping the fat when they're in ketosis, and our toxins are stored in our fat. And then when they get to 6 or 7 days, then they go into autophagy, where the body starts looking for disease tissue to use preferentially over your healthy tissue, because your body doesn't want to use your heart and your brain, for its fuel when it's fasting. So I've been blown away. And doing it in a group format too, where it's we're really focusing on healing.
That's wonderful. And that they have the encouragement of others. So mine's very limited. Obviously, people have come to me saying, I know you're the fasting girl. And they're under the medical supervision of a provider somehow. And they do it. They don't tell their provider because you don't have to call your provider every day and say, I pooped and brushed my teeth either. I just have said, you want to try it. And so they've done 3 and 5 day fasts, and they've even seen results of when they've gone in, the scans were clear. Even after these shorter fasts. So there's I don't know if it's attributed to Dr. Seifried or not, but that the 10-day fast reduces 95% of your cancer cells. Do you have any statistic that could back up? Because this is the question I always get, and I'm not a provider and I'm not trying to play one. What's the shortest fast I can do to get the best to get the quickest results or the most immediate results. What do you say to that?
Yeah. So I say, you really need to get to 6 to 7 days to start to see real autophagy.
All right.
So 9 days would be the soonest that you would expect to see any kind of shrinkage.
Great.
What I tell people who want to fast with me is that if you're really wanting to use fasting to heal cancer and not doing the conventional therapies, you need to get as close to 30 days as you can, depending on what your weight will tolerate. And you know what I'm saying? Like, we always listen to the body and we stop when their body says it's enough. But if someone's done chemo and they're wanting to just detox after all that and like basically get rid of microscopic disease, then I say like 14 days. So most of my people do
14 days then. Okay.
Because I want them to get autophagy, because
Yes.
the way cell kill during chemotherapy or radiation is logarithmic. It's similar to like antibacterial, it says kills 99.9% of the bacteria. Same thing with chemo and radiation. It doesn't kill 100% of the cells. And the reason why we think that's okay in Western medicine is because we say the immune system will take care of the rest of those cells. But what have you done when you've given chemotherapy and radiation? You've decimated the immune system. So you've got some cells that are there. And if you're wanting to use fasting, I want to make sure we're really getting into autophagy and we're getting those cells, kind of taken up and by the system. So
what about, I did have a client last year. She's a physician. She's 72 and had some type of rare, I know they always say it's rare uterine cancer. She's, she only weighed 102 when she started. And so by like day 3, she was getting down to
so you have weight limits of what
she was 94 pounds. And I just said, well, you're the doctor. I'm not. I said, I've just given you all the advice I know. And then she ended up having she said she chose to have radiation, nothing else. But what does happen to the slim person that is getting too skinny?
Yeah, not everyone's a candidate for fasting.
Okay.
So if someone's too thin, so generally, the fasting centers say that like 85% of like the lowest healthy BMI, which would be like a BMI of 19, would be like the lowest limit of what you would say fast someone down to. So, I see people and sometimes they say this is not a good fit for you because I don't think there's enough weight, because you definitely don't want to put someone at risk, their vital organs, if they don't have enough weight on them. So it's not for everyone.
Right. But if we know the statistic that 93% of the population is metabolically unfit, and that would mean high blood pressure, high fasting insulin, high LDL, all these different things, most people can tolerate it. The majority
that's what the truth is. Yeah. And you can go, your weight, the lowest weight is really a lot lower than you think, so people who, in the US, we might say that, they're relatively thin. There's actually still room but this particular woman where you're describing someone who's, 90 something pounds or even 100 pounds, there's probably no more than 10 pounds that she's going to be able to lose before she's in danger.
Right. And she did some other things. She did then after the 3, or I think she got to about 4 days. And she was then doing once a week, 1 or 2 days long. She knew, she's a physician. She was monitoring her own weight, saying, I'm at 94 pounds. I said, uncle, I said, I'm out now, and it was neat to see, that she came to me. I'm a lifelong friend. She happened to be my midwife who delivered my babies, went to medical school at age 48. It's an amazing story. Didn't do obstetrics because she knew too much, but it was amazing and humbling too, to see that even the people we put our trust in don't know what they don't know. And that it opened her eyes to the ancient practice of fasting. And it also shows us, Dr. Deming, that we have this epidemic of cancer right now. If 1 out of 2, and I told a guest earlier that cancer is the COVID of 2025. Just about everybody's got it. Like, I'm not surprised. And I'm talking about people in their 20s and 30s.
Yeah.
That something is gravely wrong. Something is broken. And I know we're trying to make America healthy again, but wow, I don't even know where to start with it. So do you think, Dr. Seyfried and others look at it all as a metabolic issue, and it is high fasting insulin is the canary in the coal mine. It's telling you that something's wrong. It's not just your blood glucose or your A1C. What do you think are markers in the beginning that would feed the cancer? Those things, those tests?
Well, I think actually, I do believe that cancer is a metabolic condition and that it comes down to the health of the mitochondria, right? This is the
All right.
whole premise of Otto Warburg's work, describing cancer as a metabolic condition, which is the foundation for Dr. Seyfried's work.
Mhm.
But I believe there are like four things that I see need to happen for people to heal cancer. So that makes me think that the problems are related to this, because these are the things that I see work. But the first is people need a calm nervous system. I think most people living in 2025 are so overstimulated, not neurologically regulated, and you
Yeah.
can't heal when you're in that state. So the first thing that I work with people on is calming their nervous system. The second thing is detoxification. So I think it's more like, part of the metabolic problem is that we are toxified, which is, when you talked about Make America Healthy Again, it's like I love that the banning of the dyes, so
It's a
the
start.
goal by the end of 2025 to ban these petroleum-based dyes, but we need to get rid of the toxins in our environment. The toxins aren't just physical. The toxins are emotional as well. Like turn on the news and just see, we're just living in a toxic world emotionally, mentally. So the second thing is detoxifying people's bodies. The third is nourishing. So we're not getting the nourishment that we need. We're not eating foods that are nourishing. This whole plant-based diet thing, I think, is a misdirect actually to keep people from the foods that we're designed to eat. We have canines in one stomach for a reason, right? And so getting people the right nourishment physically, meaning the foods, but then you need supplements, because I'm not a big, I'm not like a functional medicine doctor where I'm like, you need 1,000 supplements, but we do need to supplement things that we're not getting because of
magnesium.
Yes. Well,
Right.
and just, we're not getting the same vitamins from our foods
Right.
because the soil is stripped, minerals, all of these things. But so we need proper nourishment physically, emotionally, mentally. Also, we need to get out in the sun. We've been told to stay out of the sun, wear sunscreen, which is toxic. We're not connected to the earth. So all of these things, like getting back to those things that we haven't done. And then the fourth thing is alignment. And this is getting in alignment with who you are. And this is kind of like my whole decision to leave Western medicine is my authentic self, or, my higher self was saying, this is not where you're meant to be. You're meant to be in this other place. And that can make people sick. So I would say, I think it's multifactorial. I think we're toxified physically, mentally, emotionally, spiritually. I think a lot of us are out of alignment, living according to the way we've been conditioned, and we're undernourished in all of the ways. So if you do all of those things, you actually then have healthy mitochondria. So then, it basically reverses the problem. And that's what I'm seeing. And that's what I think that the fasting does, is that it calms their nervous system. It detoxifies them. We start to get them nourished with the right things as they come out of the fast. And then they learn who they are during that. It's like a vision quest, and get aligned.
I have so many people I'm thinking of right now who I need to send this to. First thing, then what if the first thing you would do then if you got the diagnosis, would you do a 9-day fast?
I do a 30-day water fast if I was diagnosed with cancer.
So would you load up then before on fat to help? Because I did have one client that she ripped the Band-Aid off and did a 5-day fast. She did shrink her mass. And, again, I wasn't there to help her every step of the way because that's not my job. But I'm just telling you, she called me after day 5 and said, I did it. Now she's in chemotherapy, and I think she fasts 2 days a week. It was hard. So could I have prepared her any better for a 5-day fast? See, I've been fasting so long. For me to do a 5-day fast is a little uncomfortable for a minute, but I'm metabolically flexible. Most people aren't.
Yeah, most people aren't. Well, and that's why I think, really someone shouldn't fast more than 5 days without supervision, because it's the refeeding that's actually the most dangerous about the fasting. But most people, when you're doing it on your own, it's hard. And that's actually one of the beautiful things about, when you have someone, if you're helping someone like her do a 5-day fast, to have someone to say, it's okay, your body knows how to do this. And then,
Oh, good.
Warning them about what are the symptoms. The first 3 days, you're going to be hungry. You might be hangry. You're not feeling good. You're grumpy. Day 4, you start to detox. You might have pain related to that. So for me, having the knowledge that I have now about fasting really helps people calm them down. Like I had one woman, her blood sugars were really low. Like blood sugars go down in the 30s, when people
mine got 52 once and I didn't feel great.
Yeah. But just knowing, with Seafree's work, then intention is to get your blood sugar below 65. So it's actually not a problem as long as you're, feeling okay. But so I think that, it's true. A lot of people are not metabolically flexible and it can be really challenging, but just to have someone who knows, okay, this is safe. And what are the things that you're looking for?
Because it's a mind game.
It
Dr.
is.
Deming. So much of it is a mind game. Okay. How can you see patients then in other states, or what is our?
Yeah.
Oh, good.
So because I don't prescribe medications and because I don't order like diagnostic imaging, I'm not doing, I basically see people all over the world.
Great.
So
I will send them. What website do you want to use for this?
It's katiedeming.com.
Okay. That was easy. That was cute. And they can meet with you because that's the question we get. Now we did just pass. So naturopathy is big in Oregon because I think you have third party pay, you have private insurance pay and all that. Or I know that's like where a lot of the naturopaths are in Portland. We just did pass that and the governor signed it last week here. So it gives people at least someone to talk to in the state of Arkansas, if that's their option. I just like to give people, these are your options.
Oh yeah.
So just the fact that you have this accessibility, and again, because there's no prescription writing and then how do you monitor in those groups? They can just self-monitor.
So they do their vitals every day, and I do look at the vitals, but that's like not, I'm not medically managing them. We're just making sure they're doing okay and checking in with them. And then they order their own labs actually. So
they're like anylab.com or one of those,
or LabCorp or Quest.
Okay, great.
Or their doctor. So it's rare. I just had one client and her medical oncologist from Memorial Sloan Kettering just came on my podcast and talked about her 30-day water fast, and he followed her through it. Incredible to have a doctor open.
Eyes are being opened.
Yeah. So it's beautiful.
I think people here, because I definitely, the Hippocratic Oath, I don't think anyone's trying to harm anybody, but I just think the echo chamber is so loud and so repetitive that of course I go, well, of course chemotherapy. I mean, of course radiation. And then once people start hearing, no, wait just a minute. There's something that is as old as civilization itself. Yeah. Don't eat. Have some salt and some water. Get some sunlight. Right. And I always give the Bioptimizer product, the magnesium breakthrough, I really like. And they feel better. Yeah. No one ever says during chemotherapy, I feel great. But people really do. Even in these long fasts will say, I had so much clarity. My vision improved. I mean, it is. Yeah, no,
one of my clients just sent me a message this morning. She went to go see her ophthalmologist and her vision improved by 20% with her fast.
I'm totally not surprised. I think it's fascinating. So it's a definite tool. It's the biggest tool in the toolbox. You're doing great work. Keep doing it. I found you on social media. You probably hadn't had your account long because it was small enough for me to reach out to you, because sometimes when people get too big, I'm just a little peon. But you answered this peon's email and you agreed to be on my podcast. I love what you're doing. We need more of you. I do think there's a target on your back. I felt like that with Dr. Seafried too, because, I don't want to call him the mob, but it's the money mafia of this country when I was big pharma. And you're saying, not so fast.
Well, for me, it's an ethical thing. Like I did take an oath to do no harm.
That's right.
And actually I said this, I did an episode, I got kind of crucified by my doctor colleagues about, RFK Jr. taking over, and that I was hopeful, that I was like, someone is finally saying these things out loud.
And cares about the patient. Yes.
Yeah. But before, I was afraid to really speak out about natural healing and water fasting before he came in, because people did tell me they'll take you out. You teach people they can heal cancer, and cancer is a big one. Like especially with cancer on the rise, if you teach people that they can heal cancer with water, there are a lot of people who wouldn't like me to be saying that and would like me to go away. And I've been in these conversations with other people who've been tried to be taken out, like, acid poured on people and terrible stuff. So my eyes are definitely open. When I left, I knew that I had a target on my back, and I still know that, but I do know that I will not go to my grave doing something that I think is not right.
Yeah. Amazing. Amazing. Keep doing it. Thank you for doing this podcast. Thank you for educating my listeners. This is, if anyone's listening and you know someone with cancer, and you do, send this to them. This is important. Thank you for doing this.
Thank you so much for having me. It's been my pleasure.
Thanks for listening to the Lisa Fischer Said Podcast. Be sure to hit subscribe and download all the episodes and leave a review, won't you? The Lisa Fischer Said Podcast is produced by ClantonCreative.com.